Hello everyone. On this week's podcast, we'll be talking with Dr. Julie Novak on some initiatives from the Student Health Center and the Employee Clinic as well. And then we'll be giving you an update on Chili Cook-Off and registration numbers. Hello, today we have Dr. Julie Novak. She's the Vice Dean of the School of Nursing. She's here to share with us a couple of good information for the Student Health Center as well as the Employee Health and Wellness Center. First of all, thank you for joining us today. So let's begin and if you can just tell us where your facility is located, how we can get there.
Okay, the School of Nursing is located across from the parking office and the bookstore, and both clinics are located in the School of Nursing. Student Health is at 1.422. And Employee Health is in 1.445. They're right next door to one another, and they're really close to the Louis Pasteur entrance to campus.
Okay. And what kind of services do you provide there that would be helpful to the students and the employees?
We have 10 faculty nurse practitioners and a variety of support team members. We provide health promotion and disease prevention, have a large flu vaccine program, a large TB surveillance program as well. We also do some, certainly treatment of acute episodic illness, colds, flu, sinusitis, and bronchitis. We also have many students and employees who have some chronic conditions, such as asthma, diabetes, hypertension, and we do monitor and care for individuals who have stable chronic conditions. We work very closely with the MARC, the Medical Arts Research Center, and if any of our students or employees need a referral, they can be referred to the MARC, or they may have a physician of choice in the community, and we also refer out into the community.
Okay, so whether that be the Student Health Center or the Employee Center, do you need an appointment, or can you just walk in?
You can walk in, but if everyone has a very busy schedule, so it helps to make an appointment. There will be a shorter wait. The wait is typically on average, and we've done some time motion studies. When I first arrived in 2009, students were waiting. The Employee Health Clinic hadn't been born at that point. Right. We didn't have it. But the students were waiting, 30, 40 minutes, which is really way too long. So we did some time motion studies, made some additions, went from 2 to 4 exam rooms, hired more nurse practitioners, did a lot of focus groups with students. And now the wait is between 10 and 15 minutes.
Okay.
The only exception, and oftentimes you get right in, but the only exception to that is when there's a needle stick. In the student health clinic, needle stick is the number one emergency. There aren't a lot of emergencies, but needle stick, you need to respond and enact that protocol within 2 hours.
Okay.
So if a student comes in very anxious, they've had, sometimes it's not a needle, sometimes it's a piece of equipment, a dental student working in a very close confinement in someone's mouth, and they are using sharp equipment. So they come in, they are really bumped up to first priority, and so we let students who are already there in exam rooms know that this has occurred, and then they have a choice. It'll be a 20, 30-minute wait, or they can reschedule.
Right.
So that they don't waste their time.
Right. So you mentioned about the flu vaccine. Is there any cost associated with having that?
No. The Affordable Care Act went into effect September 1, and with that, many other services related to prevention are covered under the Affordable Care Act, and that's really great news for students and employees. Okay. So the insurance company will be billed, and insurers are supposed to pay for preventive services now that they didn't have to pay for previously. Right. So the Affordable Care Act was very helpful in that regard.
Perfect. Well, that's definitely a good benefit for all students and employees at the Health Science Center to get the flu vaccine. So what can we do to make an appointment? What do we need to bring with us? Kind of those details.
You can bring your ID and your insurance card. You should have it by now. Sometimes there's a little bit of delay, especially when we switch to a new insurance vendor this year. But bring those in, and they can call, in the case of student health, 567-WELL, or for employee health, 567-2788.
Okay. And what kind of hours do you have available for both student and employee?
We're open 8 to 5 every day, Monday through Friday, and on Monday evenings for student health, we have extended hours. Okay. And we are looking at, through our focus groups, we try to be really responsive to the students. The students requested on-site lab services, so we now have Quest from 8 to 12 every day for both students and employees. In the afternoon, a courier picks up, so that we still have lab services, but we have a phlebotomist on site in the mornings. And that was really in response to a student request from the focus groups. They've also requested employee health records, and so we applied for a federal grant, which we received, and we went live last September, a year ago September, with EPIC electronic health records, and that should really, about 98% of the students have elected to migrate and use EPIC and have their records in electronic health in that EHR system, and that really does promote continuity of care. It promotes safety. There's not so much writing down things over and over again, so that sometimes things get miscommunicated in the healthcare system broadly across the nation.
Right.
And we've found that with electronic health records, it really does promote safety and continuity.
Okay. And so from now on, for both clinics, what kind of things do you see being implemented in the future? What kind of initiatives would you be implementing soon?
Well, we're doing some additional renovations. One of the students noted that the carpeting needed to be replaced, and so we've just done that recently with vinyl, which is really much cleaner and easier to care for. We've also, based upon student requests, we've done other remodeling, and we plan to continue to do that. The other thing that grew out of student requests is a pediatric evening clinic for children of students.
Okay.
And so we're going to be piloting that probably beginning in January of 2013. And as we see how that grows, we may make that available to children of employees as well.
Oh, perfect.
So we've also really been emphasizing on both sides, mental health services. We work very closely in collaboration with the Counseling Center. And we also, effective November 1, will be resuming counseling services in the Student Health Center.
Okay.
Dr. Margaret Brackley was there for several years, and some students elected to see her as a psych mental health nurse practitioner who's doctorally prepared. She just retired not long ago, and so we had a little break in those services in the Student Health Clinic. But Dr. Mark Susi and Dr. Gail Williams will both be joining us beginning in November, and they are doctorally prepared mental health advanced practice nurses or nurse practitioners.
Perfect. Okay, well, it looks like there's a lot of stuff going on in the Student Health Center. Like Dr. Novak said, definitely take advantage of the free flu vaccine. Thank you so much for joining us. I know that you have a very busy schedule, so we will have a lot of this information on our website as well if you're interested in getting some phone numbers and those kinds of details. Thank you so much.
Thank you.
And some other announcements, don't forget October 25th is the housing fair during lunchtime. Come out and visit some of the surrounding area apartment complexes to see what kind of deals they have going on for this next year. That same day in the evening, starting at 6 o'clock, will be the SGA Chili Cook-Off. We still have some availability to register your teams. So far, the School of Medicine has the most registration, and with nursing school in close second. Make sure that you register, and we'll see you there.